about 4 to 5 years. And over the past few years, I've seen the versatility of geosol, and that's part and parcel of what we're doing today. Although the focus is going to be predominantly about Redensity 1, which is a fantastic product, you will see out of the two cases, the first case, I'm going to showcase the versatility of geosol and using the different products and providing patients with a more holistic treatment. The first patient is a 42-year-old man. I saw him about a year ago, and it's a fantastic example of how aging happens in a global scale. Aging doesn't just happen in the top 1/3 of the face, it doesn't happen in an isolated part of the face, it happens in a global way. And looking at this example, a single approach is just simply not enough for this man. We need a combined approach, and that's when geosol comes in fantastically because it's got a repertoire of different products. For this particular case, what I've done is that a combined approach consisting of a deep structural support to provide a lifting effect, and with the skin we use Redensity 1. One of the 3 most attractive properties of Redensity 1 is the rehydrating effect of it and the light reflecting capability of it, and most importantly in the longer run the dermal redensification property of Redensity 1. For this particular man, deep structural support is provided by geosol Ultimate, which comes with fantastic lifting power. It's a very viscous, very thick product that's injected very, very deep. And then the superficial plane is supported by Redensity 1. Advantages of Redensity 1, it comes in the concoction of different materials, different components. If I remember correctly, it comes in 8 different amino acids, 3 antioxidants, 2 minerals, and 1 vitamins. And the concoction and combination of this recipe provides us with a fantastic product that ultimately, after completion of 3 sessions, 3 weeks apart, they offer redensification of the dermis, which you can see in this patient. Basically, how do I perform this procedure? For a very thick product such as geosol Ultimate, it needs to go deep. If it goes very superficially, one of the side effects is lumpiness. And I like to use a 22-gauge cannula. I've been using cannula for a couple of years now. It goes in 2 different planes, one supraperiosteally, which is very deep, and the second plane slightly more superficial than that in the subdermal level. For Redensity 1, very straightforward. It's injected with a 32-gauge needle, which comes with a package. It's nice and sharp. It goes in the superficial part of the dermis, or mainly the deepest will be the dermal layer. What are the common side effects of geosol Ultimate? Undoubtedly, because it's such a big product, it's got to be injected a little bit deeper, and undoubtedly it comes with slightly more tissue trauma than Redensity 1. What I normally say to my patients when it comes to geosol Ultimate is to massage the face for the first 2 to 3 weeks, and if it's possible, right on your back rather than on the side. There is usually not uncommonly some transient swelling, a little bit of redness, a little bit of discomfort as a result of tissue trauma. It is also possible that patient may potentially not to come back 12 to 18 months' time for a little bit of touching up. For Redensity 1, very straightforward because of the use of the 32-gauge sharp needle. It's not uncommon that patients have a little bit of transient redness, a little bit of needle marks, and that will go away after a couple of days or so. Usually results improve over the course of a few days, which we will see over the next slide. Another beauty of this product is the results are cumulative and is very, very visible after a short period of time. This is my second case. I've injected into the dorsum of the left hand. This is a very good case showcasing the potential of Redensity 1. Day 1, transient side effects such as needle marks, a little bit of swelling, and day 2, that's starting to subside. Day 3, you can already start to see the immediate results of the density 1, which is rehydration, as well as light reflecting. The more longer-term results, such as dermal intensification of the skin, it's going to take a little bit longer. Within 5 days, as you can see in the dorsal on the left hand, which is the injector density 1, there is quite a significant noticeable difference in the hydration of the skin.